First, COVID numbers continue to spike in North Carolina. Nearly 5,000 more people testing positive for the virus today. 10.5% of all COVID tests in the state are coming back positive. Keep in mind, we haven't seen trends like that since January. And 2,300 people in the hospital battling serious cases of COVID statewide. That is up from 125, up 125 from just yesterday. It's the highest count since February 9th.
Yeah, this coming as millions of students across the Carolinas are getting ready for this new school year. Now, the big question looming over many is if students and teachers should be masking up.
Most districts in the area are making masks optional, but a few districts, including CMS, Watagua County, Stanley County, and Anson County, are requiring them. Researchers at Duke University say that's the best move after they studied 100 school districts in the state last year.
WCNC Charlotte's Chloe Leshner live with this story tonight for us. So, Chloe, still so many kids unvaccinated. Doctors say masking really the only way to protect them.
Yeah, that's exactly right. And the research shows that masking works. They found that when universal masking was in place, COVID spread less within the classroom. It's what made in-person learning possible and safe. And of course, that's what everybody wants this year again. But as COVID cases are rising, hospitalizations are rising, they're suggesting that kids still mask up.
Last school year, the online learning struggle was real.
After this year, everyone's going to be kind of dumbed down.
Students wanted to be in person, and experts say the classroom is the best place for them to learn. But in order for it to be the safest place, too, Duke Health researchers say they'll have to pack a key school supply.
If you want to prevent COVID transmission at your schools, then it's masking until we have sufficiently high vaccination.
Vaccination is the best way to build immunity, but most school-age children aren't eligible to get a shot yet. From March to June 2021, the ABC Science Collaborative collected data from 100 school districts and 14 charter schools in North Carolina. Universal masking was in place.
Over the last year, we saw that in the mask-on-mask environment, so a masked person who was infected and a masked person who came into contact with that infected person, the risk in school for infection was less than 1%.
So far, only a few districts, including CMS, have opted to require masks for all staff and students. With the more contagious Delta variant spreading, doctors are concerned unmasked kids could suffer in more ways than one.
Thousands of kids missed thousands of school days. So if we can do masking, we can keep kids in school. The alternative in the setting of not having masking is that, one, increased risk for transmission, but two, if you are a close contact, you have to stay out of school for 10 days.
They also found that if students and teachers were masked, there wasn't much of a difference in COVID spread in the schools that were practicing 3 feet of social distancing and those that were practicing 6 feet of social distancing. By the way, CMS was included in that data. Live in Charlotte, Chloe Leshner, WCNC Charlotte.
Interesting insights. Chloe, thank you.